this, and you begin to realize it's incredibly prevalent. And in truth, every doctor has been seeing this left and right all day long, every day, their whole careers. They just couldn't previously recognize it for what it is because, number one, they had never been taught such a thing exists. And number two, it is so variable in the details. And honestly, most doctors only have, 5 or 10 minutes in a visit. You don't have time in the typical doctor-patient encounter to dig into the details. You can, address briefly one superficial issue or another, and that's it. You got to move on. So I understand the challenges, the reasons why, in spite of the prevalence of the disease, not a new disease, newly recognized disease, I understand why, despite all the smart doctors in the history of medicine, we didn't recognize this until, I didn't start to recognize it until just about 16 years ago. But nevertheless, if you're paying attention, you begin to realize this is incredibly prevalent. These patients have been seeing uncountable numbers of doctors, consuming enormous amounts of resources, and generally not getting very far with any of it, either diagnostically or therapeutically. And you see the opportunity in the first few patients, even as different in their superficialities as they were. You see just this extraordinary opportunity to turn their lives around, and especially considering that most of them, even if they don't get diagnosed and treated, they're probably going to live a relatively normal lifespan. So this becomes all about a much better quality of life for most of them for decades to come. And for some of them, it's just a quality, it's productivity too. They've been disabled, sick to the point of disability. And when you can take somebody who's totally disabled and get them back to work for decades to come, that's significant. So I started, figuring this out in more patients, and I began publishing, and I think that's an important part of it. And these patients who, thanks to the internet, they've got access to way more medical information than ever in the past. They come to figure this out much sooner than their doctors do. And so they started coming to me from all over creation. It really was remarkable. And that's a long story, but here we are today.
Have others seen a similar story?
I have. So you referred to your own case history, and you and I and your other doctor, Dr. Goodman, published a case report in 2018, and we worked on it since basically your treatment over since 2016. Anyway, bottom line, we published this new treatment for you. And then if you Googled POTS and MCAS for 4 years, it came up as 1, 2, or 3 on Googling. And that led to many emails and people asking if they could be my patient or where could they find this treatment and so forth. The internet is powerful. I had a patient not too long ago who basically wrote down all of her symptoms, typed in all of her symptoms, and it came up with MCAS and my name, because obviously she was from Missouri. But that just shows you where people are going. The patients are ahead of the game. So my day is 12 colonoscopies as gastroenterologists, come back to the office and see 7, 8 patients who either have MCAS or think they have it and often do have it. So my life has turned around dramatically since 2018 when we published that case.
For me, it was a patient who came to see me, had a very ruddy complexion, flushed, and had POTS. And she said, "Doctor, I think I have mast cell activation syndrome." Well, what is that? I've never heard of this. This is well pre-pandemic. I'd say around 2014, 2015. And I'd never heard of it. And my initial response was resistance. And over the course of time, looking into this more, measuring her own serum tryptase, which turned out to be elevated, very lucky, because very often it's not elevated. But I had some argument for this diagnosis. And so I started to become interested in it. She mentioned that she had been in communication with Dr. Afrin. I said, "Who is he?" and started looking him up. And over the course of time, my resistance slowly melded into, if not acceptance, at least a begrudging willingness to consider it. But I wasn't sure how it really related to neurologic disorders, specifically small fiber neuropathy and POTS. But over time, as I got to know Dr. Afrin and became a member of our Masterminds listserv, which is enormously helpful. I've eventually come to the point of acceptance and even adoption. It turns out that I probably have some mast cell symptoms myself. When I sneeze, I never sneeze once or twice. It's 10 times. My father had terrible rhinitis medicamentosa because of a lifelong sinusitis, and basically got himself addicted to, the Sudafed in old time inhalers. And so it's probably something that does run in the family. And, again, begrudgingly looking at potential allergens like mold. I've been very resistant to that, but I'm coming around. So I am a slow adopter, but I have been very impressed with that. In order to convince people, you have to convince them that they might have it, or maybe their daughter or son or spouses have it. And that is a very good way. And it turns out my daughter has mast cell activation syndrome and has done well on the very easy over-the-counter cocktail that Dr. Afrin and others have described. So, the barrier to entry to treating this disorder, I think, has a huge advantage for us in getting people to adopt it, because it's something that their doctors don't have to prescribe some controlled substances to make this work. So the hurdle is low.
Like a lot of other people, this was not a planned thing for me. I grew up with severe asthma, terrible allergies, went through all the immunotherapy, eczema, irritable bowel, migraine, a whole bunch of things that we now know are associated with mast cell, and practiced for over 20 years in the operating room. And then when I opened my clinic in 2017, again, not a planned thing, but to do pain management for people with EDS, my second patient had been diagnosed with psychogenic non-epileptiform seizure disorder and had stopped driving, and she was young. And the mom had asked me, during one of my talks, do you think you could help my daughter? And I was like, I have no idea, but I'll try. And so I prescribed and did some of the things that I had learned from Dr. Afrin. And she came back after 30 days, and I was shocked. She had no events. And I almost fell out of my chair. I was like, it actually worked, because you really don't know until you actually try. So it definitely has been more of an evolution for me that I've been incorporating more and more into my practice and doing more screening and things like that. And so I am so grateful also for the listserv and for the incredible